Right, so something that I think about a lot, I talk with people a lot about, is this idea that the higher level therapies that we talk about here, so the prolotherapy, platelet-rich plasma, adipose, bone marrow, all that type of stuff has to be layered on top of a foundation. Okay, these therapies are high tier therapies, and in our therapeutic order, the order that we want to treat people, we are generally going to work from a bottom up approach. This is kind of like a pyramid. And so back to our pyramid discussion, the bottom of this pyramid is the foundation. This is the stuff that needs to be done on a daily basis to support everything else above it. And the other things above it are going to be things like physical therapy, going to be things like acupuncture, going to be things like the regenerative injection therapies, could be surgery, could be a steroid injection. It's all of these things that are higher tier. So the higher up you go in this pyramid, the more invasive the therapy, and the less frequent that therapy should be done, and in less number of people, because the most people are going to see major benefits by just laying the foundations. And then of those people that don't, we move up to the next tier and the next and the next and the next, okay? So when someone comes to us for these regenerative injections, we're still always talking about and making sure that these foundational layers are at least discussed and addressed. These foundational layers are the stuff that you guys can do at home for basically free, minimal cost involvement compared to anything else that you might do. And I'm gonna walk through a bunch of those with you right now. So one of the first ones is helping to set up a proper circadian rhythm. This means that your body feels awake when you should be awake and you sleep deeply when you should be sleeping. Some of the best ways to do that, number one, is to get morning sunlight. So within the first 30 to 60 minutes of waking up, preferably, within the first few hours of sunrise, if not at sunrise, is you are getting outside and you are getting light on your face so that the light hits the receptors in your eyes, and that can help to stimulate the part of your brain that says it is now daytime. So doing that in the morning, if it's a super bright day, you might only need 2-3 minutes. If it's a little bit cloudier, you might need 10 to 15 to 20 minutes. Now, some of you will wake up before the sunrise, and in that situation, we're gonna recommend getting lights. You can get them on Amazon. They're called box lights. They are generally used for seasonal affective disorder, looking for around 10,000 lux. And you can also do that for 3 to 10 minutes in the morning, is shine that on your face to let your brain know that it is time to wake up. Then with that is making sure that you're cutting out caffeine by not having that too late in the day. For me personally, I find cutting it out around 11 a.m. Works best for me. I also delay my caffeine a little bit. That is an Andrew Huberman recommendation, to delay your caffeine about 60 to 90 minutes after waking up, which I know sounds super scary and super hard for a lot of people. And it actually wasn't as hard as I thought it would be. Although there are some days where I really just want the habit and the experience of my coffee earlier, but I waited out. So so for me, I wake up usually around anywhere between 5:30 and 6:30. I'll start having caffeine then about an hour later, so between 6:30 and 7:30. And then my limit is, I can drink it until 11 o'clock, and then it's a hard stop. And I have found that personally helps me sleep best in the evening. Then in the evening, getting outside and trying to view the sunset. That can help to set your circadian rhythm even further, saying that, okay, it is now nighttime. So start of the day, end of the day, you're setting this circadian rhythm. So that is gonna be one of our big foundations, because if you're not sleeping, you are not properly healing. You can probably hear if you're not sleeping, but you're probably not healing very well, or as well as you could be. So we got the circadian rhythm down. Next, I talk a little bit about nutrition. Look, there are so many different ways that you can approach nutrition. There's the paleo, there's carnivore, there's vegetarian, there's vegan, there's pagan, there's all of these, different types, and they all have one big thing in common, and it is elimination or a significant reduction in processed foods. Foods that are made in factories, they're in boxes and bags, they've got nutrition labels on them because, they are processed foods. So reduction in those, and an increased amount of foods that are naturally found in nature. Fruits, vegetables, legumes, animals, all that type of stuff. Those things are going to be really, really helpful in helping to support your body to have the right amount and the sufficient amount of micronutrients and macronutrients, as long as you are not underfed. Generally, if patients are trying to heal, we like to increase their protein intake a little bit, looking at anywhere between 1 to 2 grams per kilo of body weight is generally what we're going to try and shoot for. Making sure we're getting enough fiber in the diet. You know, shooting for even upwards of 50, 60 grams of fiber can be really, really helpful for a lot of people. Helps with gut health, which then helps with your overall health. And then limiting our processed foods, our sugars, our sugary drinks, eliminating all soda. I don't even care if it's diet, eliminating all soda, diet soda. If you need a substitute, choose something like Topo Chico or Gerolstein or another mineral water that I really like because it's high in magnesium content. All right, so we got circadian rhythm, we got nutrition. Now let's talk about social connections. It is so, so, so important for you guys to think about and audit the people that you are spending time with. Now, it can sometimes be a vicious cycle, especially right now in such a polarized society where we want to talk with people who have our belief systems. But sometimes that can become toxic because that starts to separate us further from the other groups, which those other groups are also humans. And it can perpetuate this toxicity where we just continually bash on other people and send out negative energy. You really got to audit and try to limit the amount of time you are putting out negative energy and spending time with people who are putting out negative energy, whether it's directly towards you or if it is at others, because that negative energy can and does affect you, okay? So audit your inner circle of people. If you are at a toxic workplace, I highly consider you to consider maybe you should find a new job, whether it's in the same field of study or it's something different. Find a new career, find a new job. I've had patients who have moved towns just because everything in their town to them was so toxic, and their life and their health just improved so much. So that is something that you should really consider. All right, next we're going to move on to hydration. So hydration is not just as simple as drink lots of water. A lot of people think that they're hydrated because they're drinking a gallon and a half. I have people come in who are drinking 2 to 3 gallons a day, and they are not hydrated. The reason for that is because hydration is not just water in. That water needs to carry minerals with it. Most of our tap water is terrible for us because it is laden with pollutants, pharmaceutical drugs that are not properly cleaned out. And so a lot of people move towards things like reverse osmosis. That strips out all of the minerals from the water, which the water is actually a source that we get minerals from. And so what I'm generally recommending is a lot of patients will add in a particular sea mineral product. It's called Quinton. We're generally using the hypertonic. We're using that about 10 mLs in the morning. Fantastic, fantastic source of minerals for the day. On top of that, we're also generally adding in some trace minerals as drops to the water throughout the day, along with a pinch of sea salt. What we found is when we do that, we take people who are always feeling dehydrated but drinking a gallon and a half a day, where we're bringing them down to, closer to like half to 3/4 of a gallon with minerals, and they're finally feeling quenched. They're not dehydrated anymore. And so if you're feeling dehydrated all the time, or you always have to have water, I used to be like that. I used to have to carry a water bottle with me all the time, no matter where we went. And while I still bring it a lot of places, I now don't have to bring it everywhere because I have a proper mineral repletion strategy in there with my water. Lastly, we're going to talk about movement and exercise. This is an absolute crucial thing that you need to figure out how to incorporate into your life. The reason for that is because it improves blood flow, it improves lymph flow. Both those things are going to directly help with the healing process, bringing new nutrients into an area that might be hypovascularized, tendons, ligaments, things like that, and also to clear out metabolic waste that has been collecting, especially if you have any swelling, whether that's swelling in the legs in general, or if that is actual swelling within a joint or something like that. And that's going to be the lymphatic system, okay? Movement is going to help with blood flow and lymphatic system. When you start getting into more strength training and different types of exercise, structured exercise that is more, what's the word I'm looking for, not maximal, but it requires a lot more effort, is also you're going to have hormonal changes, you're going to have neuroendocrine changes, you're going to have changes in your inflammatory status. So you're going to increase the amount of anti-inflammatory myokines, which are cell signaling molecules that come from muscles, and that in and of itself can help to reduce systemic inflammation. Now, I understand that if you're in chronic pain, this is always difficult to do because a lot of the exercises might cause you pain. This is where you have to start experimenting with different types of exercise, different exercises themselves, or different ways of getting movement in throughout your day. So for example, if you can't go to the gym and work out because you have back pain, but you can walk for an hour and not have any back pain, then I encourage you to go do that walk for an hour, even if you can't get to the gym, because that's going to still be movement and it's going to be better than nothing. And then maybe after doing that for 30 to 60 days, you now might be able to do some incline walking, and you might be able to get some more actual effort into that exercise, more muscle building. So that way you can actually start to layer that on top and get more benefits in the long term. Or is some people might say, well, I've got a bad knee, so I don't go to the gym. You can do a lot of upper body exercises that do not require you to use your knees. There are also a lot of lower body exercises that you might be able to do that you didn't know you could do because you never explored and experimented, that don't actually hurt your knee, and you should do those. Working with a physical therapist or a strength and conditioning coach or a strength trainer here can be really, really helpful, even a personal trainer, because they can help guide you through this process. Now, when we start talking about, going to work with somebody, you have to understand that there's going to be a continuum of expertise. And so you want to make sure you're doing a good job at interviewing these people and not just picking the first person that you find, because they may not be able to help you tailor your exercises based on your pain. Something that a lot of people don't consider is swimming or water aerobics or even just walking in water. That in and of itself can be a good way to get movement and exercise into your day that maybe over a 3-month period, you might be able to transition out of the water. And now you might be able to do some of those activities on land because you've been improving your body's natural ability to heal through the water exercise. And now you can do that later. These are the foundations. These are the things that are going to help set your body up to heal. It's not everything you can do, but these are a lot of really great ideas for you to get started today.